Basic anatomy. Use of technology in anatomy, virtual anatomy, computer-based simulation or VR to study anatomy without cadavers. 3D models. Used to better visualize the relationships of organ structures. Imaging techniques. CT scans, MRIs, and USGs help in understanding anatomy in real time on patients. Use of technology in anatomy refers to the application of modern tools and techniques that help in studying, visualizing, and understanding the structures of the human body in a more accurate, efficient, and non-invasive manner. With the advancement of technology, anatomy is no longer limited to traditional dissections or textbooks, but involves various sophisticated devices that allow teaching and applying anatomy in a more interactive, realistic, and dynamic manner. Here are some of the uses of technology in anatomy in detail. 1. Medical imaging. Medical imaging is one of the most important technologies in clinical anatomy. Various imaging techniques allow for non-invasive visualization of internal body structures, providing a clearer picture of a person's anatomy for diagnosis, treatment, and education purposes. A. X-ray, radiography, description. Uses radiation to produce two-dimensional images of the human body, often used to view bone structures. Applications in anatomy. X-rays provide images of bone conditions, fractures, lung abnormalities, or the presence of fluid in the body. Although X-rays are more limited in visualizing hard tissues, they remain the foundation for studying and understanding musculoskeletal anatomy. B. CT scan, computed tomography, description. CT scan is an imaging technique that produces cross-sectional images of the body using X-rays combined with a computer. Applications in anatomy. CT scans provide three-dimensional, 3D, images of the human body, including internal organs and blood vessels. This allows doctors to examine body structures in more detail. For example, to diagnose tumors, internal bleeding, or fractures. C. MRI, magnetic resonance imaging, description. Uses magnetic fields and radio waves to produce detailed images of soft body tissues such as the brain, muscles, and internal organs. Applications in anatomy. MRI allows visualization of body organs in high detail, very useful in studying the structure of the brain, spine, joints, and internal organs such as the liver or kidneys. This allows anatomists to map soft tissues accurately without involving radiation. D. USG, ultrasonography, description. Uses high-frequency sound waves to produce images of internal organs. This technology is safe, non-invasive, and real-time. Applications in anatomy. Ultrasound is very useful for visualizing abdominal organs, such as the liver, kidneys, or pancreas. as well as for monitoring fetal development in pregnancy. This technology allows doctors to see live images of organs and check for abnormalities in the body. PET scan, positron emission tomography, description. PET scan is an imaging technique that uses radioactive isotopes to visualize metabolic activity in the body. Applications in anatomy. PET scans are used to detect diseases such as cancer by showing areas of the body that have high metabolism, allowing for more detailed mapping of cell or organ activity. 2. Digital anatomy and augmented reality, AR. The use of digital technology and augmented reality, AR, has brought great advances in anatomy education, allowing medical students and medical professionals to learn about human anatomy in a more interactive way. 3D models and digital anatomy, description. 3D models of the human body can be accessed through computer devices, allowing users to view and manipulate anatomical structures from various angles. Applications in anatomy. This technology is used in medical education to help students visualize human organs in detail, learn the relationships between organs, and clarify the topography of the human body. For example, software such as 3D for medical or visible body allows interactive anatomy learning using 3D models. Augmented reality, AR, and virtual reality, VR, description. AR and VR combine the real and digital worlds to create immersive, interactive experiences. With AR, 3D images of anatomy can be projected onto the real world, while VR allows users to explore models of the human body in a virtual environment. Applications in anatomy. AR and VR technologies are used to provide a more realistic and interactive anatomy learning experience. For example, using a VR headset, medical students can step into the human body and explore anatomical structures in real time. AR can be used in surgery to project real-time images of a patient's anatomy onto their bodies during procedures. 3. Interactive learning systems and mobile apps. A variety of apps and software have been developed to help learn anatomy in a more practical and flexible way. Anatomy learning apps. Description. Mobile apps such as Anatomy 3D and Complete Anatomy allow users to access 3D models of the human body with interactive features. Applications in anatomy. These apps allow users to study the structure of the human body in detail and access information about various organs, systems, and tissues of the body. These apps also support anatomy testing and exercises in a way that is easily accessible anytime and anywhere. Online learning platforms. Description. Online platforms such as Khan Academy, Coursera, or edX provide anatomy courses that utilize multimedia technologies, including videos, animations, and interactive simulations. Applications in anatomy. These platforms make it easy for medical students or medical professionals to learn anatomy in depth without having to be in a traditional classroom. Animations and simulations allow for a better understanding of organ function and the relationships between body structures. 4. Robotics and surgical simulators. Robotics are also beginning to be used in anatomy education, particularly to facilitate more realistic and safe surgical simulations. A. Surgical simulators. Description. Surgical simulators use computer technology to mimic surgical procedures in a highly realistic manner. They are often equipped with tactile, touch, feedback to provide an experience similar to real surgery. Applications in anatomy. Surgical simulators help medical professionals practice various surgical procedures without risk to the patient. In-depth knowledge of anatomy is required to perform these simulations, as the user must understand the anatomy of the organs and tissues of the body being simulated. B. Surgical robots. Description. Surgical robots such as the Da Vinci surgical system allow doctors to perform minimally invasive surgical procedures with more precise control. Applications in anatomy. Surgical robots help surgeons perform surgery more precisely, allowing them to access hard-to-reach parts of the body. In this case, the anatomy of the human body must be understood very well to avoid injury to body tissues during the procedure. 5. Anatomy education with virtual dissection. Virtual dissection is a method that allows medical students to learn human anatomy through computer simulations without having to dissect a human or animal body. A. Dissection simulation. Description. Using software that displays the human body digitally, students can virtually cut through layers of the body to observe internal organs and other body structures. Applications in anatomy. Virtual dissection is very useful for teaching anatomy, given the limited access to the human body for physical dissection. It also reduces the waste of resources and avoids the discomfort that may arise from animal or human dissection. Conclusion. The use of technology in anatomy has changed the way we learn and apply knowledge about the human body, both in educational and clinical contexts. Medical imaging, augmented reality, virtual reality, interactive learning applications, and robotics are some examples of technologies that have made a major impact on the understanding of anatomy. With the application of these technologies, doctors, medical students, and other medical professionals can be more effective in diagnosing, treating patients, and understanding the structures of the human body in a more in-depth and realistic way.